Dr. Khoshaba is a leader, speaker, educator, and advocate in her field, receiving her doctorate from Sonoran University of Health Sciences, formerly Southwest College of Naturopathic Medicine. She focuses on identifying and treating the root causes of disease and considers the physical, mental, emotional, genetic, and environmental aspects of her patients' health. Welcome, Dr. Khoshaba. It's so nice to have you. So first, I'd just like to start with having you share with us a little bit about your practice and the types of patients that you treat here.
So our practice is a naturopathic endocrinology clinic, and we treat patients with hormonal imbalances. The majority of patients who seek our help struggle with thyroid disease, and they seek our help because we offer a natural and an integrative approach to treating their thyroid condition. And the patients want to understand the root cause of their condition and their disease and not just manage their symptoms.
As a naturopathic clinician, what are some of the key treatment options that you keep in mind when you're considering a regimen for a patient with hypothyroidism?
So as I alluded to earlier, we do take a holistic approach. That means to consider all types of options available when treating hormonal conditions, especially for thyroid disorders. So our treatment selection is very individualized, and it's based on the needs of the patient. For instance, there's natural thyroid medication that's available, and it's known as natural desiccated thyroid, NDT. Mm-hmm. And NDT is a really good option for patients who need a combination type therapy, such as T4 and T3, which are thyroid hormones. There's also monotherapy available, which is T4 only. In the past, I believe that, a combination approach was a little bit better than the monotherapy, because that's what I would see from a clinical perspective. Mm-hmm. However, I've been really impressed and really happy with the new monotherapy that I've been using, tyrosine solution, and I've been finding some really amazing benefits in patients. And I've also seen it with the capsules. But I recognize that patients, sometimes you have to individualize it. Sometimes that combo therapy might be appropriate, and sometimes monotherapy is a little bit more appropriate. And we also have a principle in naturopathic medicine, first do no harm. And I also believe in using the minimal amount to get the maximum benefit as well. So natural desiccated thyroid is a really good option for patients who need combo therapy with thyroid hormones such as T4 and T3. However, there have been some inconsistencies with natural desiccated products, and this could affect stability, and then clinically there's a lot of variability in patient results. So that's where I decided to seek out monotherapy, and I started to use tyrosine solution and capsules to see how monotherapy would work. And in the past, I believed that combo therapy was a superior approach, but I was just super excited and just amazed with the results that I was getting with monotherapy. So I decided to use a lot of monotherapy. Of course, there are patients that do require combination therapy. That's where I tend to use tyrosine along with liothyronine to allow me to get the results. But I think that's more of the minority of the patients than the majority of the patients that I've seen.
So what recommendations in terms of maybe exercise or dietary do you typically recommend for your hypothyroid patient? Because it sounds like this is a holistic approach. It's really a lifestyle change.
Absolutely, right? Absolutely. So when we take a look at the thyroid, we're analyzing the whole endocrine system. We take, for example, we test for their adrenal function and their thyroid function and their GI system. We also test their sex hormones, and we want to understand the connection and interplay between these hormones. And we also look for key nutrients that might be in excess or in deficiency, and we try to correct them. We also offer specialty lab testing here to identify things such as food sensitivities, their GI microbe imbalance, any kind of toxins that they're exposed to. In terms of exercise recommendations, that's all individualized, so it depends on the need of the patient at that time. But we also encourage this overall approach, and we actually consider all aspects of health: social, emotional, physical, and mental well-being. Yeah. And so when you take this type of approach, you can address health on all those key levels, and then that ultimately the patient succeeds in feeling really good, and especially their thyroid condition or other hormonal condition improves.
Yeah, absolutely. Absolutely. So what has been your experience with Tircent Sol and patients who might be taking other medications? We know that patients who are usually on some sort of levothyroxine therapy, that can be a trouble spot for them. But how has Tircent Sol been able to manage your patients who are also on medications that are known to interact with the drug?
Of course, we run lab work on every single patient to help us objectively identify where their hormone levels are. And then based on those findings, then we recommend the medication. There are some certain circumstances where medication isn't even required, and we just help to give them thyroid-specific supplements to help support their endocrine system and their overall thyroid function. Tircent solution is one of the most cleanest and purest forms of levothyroxine that's available. And this is really important because the patients that come to see us tend to have a diagnosis of hypothyroid or hyperthyroid, also autoimmune, Hashimoto's or Graves'. And along with these thyroid conditions, there's a lot of comorbidities that exist with them. For example, there's a lot of GI comorbidities such as celiac disease, atrophic gastritis, inflammatory bowel disease. And it's very important that if they have these comorbidities, they're taking the cleanest and purest form of the medication. So ultimately, they have the best response. And this is where Tircent Sol is amazing because it's free of problematic excipients such as gluten and dairy. And so a lot of these patients that come in with these thyroid conditions and comorbidities have sensitivities. So this is a really good therapy option for them. Tircent solution is another great option for patients who are using multiple medications. For example, PPIs, those are proton pump inhibitors. Those are medications used for patients who have acid reflux. And these medications are available over the counter and in prescription form. But there's so many patients that are on these things, and we know with Tircent solution that there's no impact when taken along with these meds. So that allows for greater stability and getting that thyroid dialed in, especially for a clinician. It's super important that we take all of these things into consideration. In addition, it's not just PPIs, but also patients take supplements. So knowing that this is the most purest form of the medication being delivered, there's less risks and chances for thyroid levels to be off. But this is where I've seen Tircent solution have the greatest impact on my patients. Oftentimes when I've switched from a natural desiccated thyroid or even a generic levothyroxine over to Tircent solution or capsules, I have noticed that I've had to reduce their dose. So that's an amazing response that you need less medication to achieve the best outcome. Another thing that I love about Tircent solution and our capsules is that it's available in a wide variety of doses. And that's super important as a physician and a clinician to kind of help patients get their thyroid scores dialed in. So even though they come in with normal scores, we want to get patients to optimal scores. So for example, with Tircent, it comes in, the liquid, the solution comes in a 44 microgram dosage and a 50. And that little incremental difference will make such an amazing and positive difference for the patient. So it's those types of doses that are available that helps us to optimally dial in our patients.
So I know you were sharing with me a little bit about your own inter-office analysis that you've done recently. Is that right?
Absolutely.
With Tircent Sol. Maybe you can share a little bit with us what that experience was and what you learned from it.
I conducted a retrospective case analysis of patients in my office, and what we did is we looked at switching them from a natural desiccated thyroid over to Tircent solution. And what we found that when we did that is that it ultimately resulted in normalization of thyroid levels, more consistent levels throughout the entire time. Patients felt better. They tolerated the medication really well, and ultimately resulted in them feeling better, and as well for physician satisfaction that we were able to make sure that these patients are not going high or low. And I felt like it was a really good option for these patients.
That's great, Dr. K. I definitely look forward to reading that paper. I think beyond having a treatment option that's safe and efficient, I think a lot of clinicians also want to know how is the best and most affordable way to get access to their patients with these medications. So as a clinician, what would you say has been the most efficient way to get a branded product like Tircent Sol into the hands of your patients?
We use the Tircent Direct program, And this is a network of mail order pharmacies that help patients get the lowest out-of-pocket price for the medication. These pharmacies take care of all the prior authorization forms, and they have a high success rate of getting it approved. What they do is they often send me a form, a prior auth form, and it's a really simple form that my staff are trained to fill out, and it's a lot of check boxes, and it's really quite simple. And then we fax it back, and majority of our patients get it approved, or they do find the out-of-pocket price really quite affordable.
So this has really been such great information, Dr. Khoshaba. Thank you so much for taking your time to share with us today your clinical perspectives on thyroid care and how Tircent really has made a difference in your practice.
Thank you very much for having me here today, and I'm hoping that this information that I've provided will also help other providers and practitioners out there who have patients struggling with thyroid conditions and disease and they're not being stabilized. So I think it's a really good benefit, and I highly recommend it for a lot of providers out there. So
thank you.
Mm-hmm.